ready to go live?
Yep, we are live, and I can go ahead and do the roll call. This is Jared Wassinger. I'm Dennis's proxy today. He's out, so I'm gonna get you all kicked off and then run the meeting here and let you all go. So start off with the two co-chairs, Jason Smith.
Here.
Bob Koppel.
Here.
Carla Hagemeister. Okay. Lisa Sicily.
Here.
Ed Callis. Robin Cole.
Here.
Linda Cook.
Here.
Dennis Butler.
Here.
Mike Dotson. Dennis Cook.
Yes.
Gina Scroggs.
Here.
Mickey Dean. Tara Hawley.
I'm here.
Kelly Laub. Cheryl Grice. Shiloh Hager.
Here.
Fanny Fang. Karen Hibbard.
Here.
Lonnie Baker.
Here.
John Ford.
Here.
Dee McKee. Keith Asher. Julie Govert Walter. Kelly Pascoe.
I'm here.
Dr. Chase. Lieutenant Colonel Kelly. Charles Martinez. Vern Hendricks. Steve Elstrom.
Here, and Colonel Kelly will not be able to join us today.
Thank you. Ron Fear.
Here.
And Chrissy Rodriguez.
I'm here, and we also have Marissa, that's a part of my team as well. Thank you.
Great, and then Cheryl is just now joining us. So, Jason and Bob, you can kick it off.
Perfect. Right. Thanks, Jared, for covering for Dennis. I want to thank everybody for joining us again this afternoon and sharing some of your time. Hope everybody had a good Christmas and a very safe and quiet New Year away from other people, right? Social distancing, right? So certainly we've gotten off a little bit to a start here in 2021. I think our last meeting was on December 17th, and so there's certainly been lots of developments since then. A lot of testing actually completed over the last month. Vaccination process has really gotten started in our county and in the surrounding counties over the last month. Federal government passed stimulus package. We'll talk a little bit about that today. We've got schools back in session, so we're going to actually have opportunity to both talk with K-State's rep and also Carla about USC 383. The business confidence survey that we had talked about at our last meeting is actually out, and so I think either Marissa or Christy will maybe give us a little update on that. The local health orders, I don't believe they have really changed since our last meeting, but certainly we're seeing some activity related to COVID. We're going to dig into a little bit more detail. And just as a reminder, the health department in Riley County does require a permit if you're going to have a gathering for more than 50 people. So One of the things we want to just kind of talk about first, because I know it's a big topic, both within our group and in the community, is just about the vaccination rollout. And so we want to just give Julie Gibbs, she's with us as a guest today, our county health officer, give her an opportunity to just kind of give some updates, talk a little bit about process, and kind of that'll help maybe set the stage for some of our other conversation around vaccination. So, Julie?
All right, thanks, Bob. Thanks for inviting me here. I have just some general updates. Some of this is the same information. If you listen to Facebook Live yesterday, it's some of the same information just because I don't have much more since yesterday. But I do have some good news. We did receive a shipment of 2,500 doses of vaccine today. So I'll include that in my little update here, and then I'll certainly take any questions that you have. So last month, you're probably all aware, we did administer just under 500 vaccines to healthcare providers, urgent care facilities, so KSTAT staff, EMS staff, some health department staff that are frontline. They're helping with the vaccinations and also helping with the swabbing. And I just wanted to let everyone know, a common misconception that we have is that, or that we hear is that we're just sitting on vaccine here, and that's not the case. When we receive shipments of the vaccine, we schedule to get those out right away so that we can get more people vaccinated quickly. So our goal is to always get the vaccine in arms, not to have it sit on shelves. And we do this, we did this with our first 2 clinics. The only shipment actually that we've received directly from KDHE was back on December 21st. We received 200 doses, and we turned around the very next day and administered most of those doses at Bramlage and Bramlage parking lot. And the rest we administered later that week. So we want to get those in arms as soon as we can. The next week, we received 270 doses from Konza Prairie Community Center, and we administered those the very next day. We did receive our second shipment from KDHE today. Like I mentioned, we have 2,500 doses in hand that will get us through at least the first dose of phase 1 with our healthcare providers. So we'll at least have those completed, the first dose at least completed. Our clinic has been very busy making contact with all the licensed healthcare providers in the area. So we now have their prioritization lists in hand so we can schedule those clinics right away and get everyone vaccinated. So we're making those calls as we speak to get those scheduled. We hope to have all of our healthcare providers or phase 1 vaccinated by the end of next week. And keep in mind, again, this would just be the first dose for many of them. We are working on our second dose for those that we were able to do that week of Christmas and the week of New Year's. And while we've been in contact with most of our licensed healthcare providers in the area, if there are other providers that we haven't reached out to, we're just asking them to email us at COVID-19 vaccine, that's COVID-19 vaccine at rileycountyks.gov, and we'll get them on our list. Once we've finished administering those 2,500 doses, and when we have more vaccine available to do so, we'll move on to phase 2, which includes those 65 and older, contact critical workers and congregate settings. Dr. Norman's goal is to have all counties in Kansas move to phase 2 together, and hopefully by February 1st. So we're using that new KDHE guidance that was released last week. That's what we're using to prioritize and move into phase 2. And we'll be notifying everyone when we're moving into that phase in order to make sure we're reaching those who want the vaccine. You might have seen this late in the afternoon yesterday. We did put out a news release that we have an online vaccine request form available. So to sign up, you go to rileycountyks.gov/vaccine request. And you can fill out the form there. It's just general information, your contact information. We ask you some health related questions, who your provider is. You don't know the answer to any of those. Of course, there has to be something in those fields. So you can always put none or I don't know or NA. We just have to have something in those fields. If you have somebody that needs help with that form, help filling out that form, you can give us a call at 785-565-6560. And we have health department staff who can help you to manage that form, or they can answer any questions that you might have. We're also asking anyone with general questions or concerns regarding the vaccine, not necessarily the form, to email us at vaccine@rileycountyks.gov. Any questions?
They're making this too easy, Julie.
Julie,
No.
this is Tara in Wambigo. I was wondering, my parents are 87 and 89. They live here in Potawatomi County, so you may not be able to answer this, but while you're here, I thought I'd ask you. They received a basically computerized phone call from Pot County Health Department that said press 1 if you want to get on the list for a vaccine. Does that sound legit to you?
Possibly, I would contact the health department and ask for sure.
Okay.
I'm not sure about that.
Julie, I just want to say, wow. I mean, it just feels like suddenly, everything is, you guys are so not suddenly well organized. You've always been well organized, but this vaccine is just suddenly, flooded out and everyone is having to deal with it. And it just sounds like you're doing a really great job with it. So kudos to you and your team for continuing to deal with this crazy situation.
Thank you. Appreciate that.
Well, you're welcome to hang on in case there's anything else comes up, Julie, or we know that if you need to run, that's good too. I guess a couple of things related to vaccination we wanted to touch on, because I think we talked about this in December. We really do see this as an economic development enhancer. So as vaccine does become available for the community population, I think we really need to have a concerted effort to encourage people to get vaccinated, because that's the way to ensure workforce. It's another, I think it's another leverage point we can use to market, to have people come here to do the retail or et cetera. So I do think it is, it's really important for us to take advantage and leverage these opportunities. And, to Julie's point, when we've had vaccine available, I think everybody's done a good job of getting it deployed. And there's a whole lot of reporting on the back end, which I think is where some of the concerns have been raised about people saying, well, what doses not being given. I think they've been given. There is a little bit of work to get all of this reported, and it's one person by one person. It's not, you can't just do an upload. And so I think that is part of the, kind of adds sometimes to some of people's concerns. Gina, were you going to say something?
Yeah, I just had a question. Do we have any idea percentage wise of refusal of the vaccine? Are we following a trend at all nationally, or do we have any idea about that? And yes, I want to thank you too, Julie. I want to jump on Lisa's bandwagon and give you all the gratitude and thanks for awesome job. Thank you. That's my question.
Thanks, I appreciate that. I'll let Bob answer this. I'm not sure from the individuals that we've talked to, most individuals do want the vaccine. I know here at the health department, we've had very few that said that they don't want the vaccine. So, but I haven't spoken with the general public either.
Yeah, so our experience with our workforce and the physicians, so we started vaccinating on December 16th, and we've given 550 odd first doses either here or in Wamego to our employees or to the active members of the medical staff. With the active members of the medical staff, 100% of the physicians have been vaccinated. And I think that's actually pretty important for people to hear in the community.
Yeah.
I mean, 100% of our doctors have gotten, they've already got their first dose, and we're about halfway through already doing the second doses. We have another 96 on Monday, and so that's going to be another big chunk. So with the physicians, it's actually been 100%, which is both amazing and it's also really great. With our staff, we actually have a pretty high percentage of folks too that are taking the vaccine. Those who are not, we talked about this a little bit yesterday, I think on the FaceTime Live with the health department, probably around half of the folks who are expecting have opted to wait. The other half have actually talked with their physician and they're getting their vaccinate, have already gotten their vaccination. Probably about half the people who are nursing, they're also, about half of them are choosing to get vaccinated, the other half are not. We have a handful of people that because of their faith tradition that they follow, they don't get any vaccinations. But by and large, this has been not a question of if people want to get vaccinated, it's the when can I get on the schedule. just because of life circumstances, we have some folks who didn't get their first round as we were doing our 550. So we have another 30 staff that are getting their first vaccination next Monday. And so that'll just be more people kind of then into that process. But by the 1st of February, the first 550 will have had their second dose here in Waukegan. And that's your healthcare, your acute care healthcare providers. Julie's team has vaccinated a lot of the primary care clinic staff, the K-STAT urgent care staff, and that's just kind of starting to now kind of work its way out through the rest of the medical community. So again, as Julie indicated, around the second week of February, we will actually pretty much have the healthcare workers vaccinated. All of 4 of the long-term care facilities in our county, their folks have been vaccinated now. I think I'm right in that, Julie. Is that, yeah. And that included their staff. They've all had their first dose, and they start second doses at one of the facilities next week. So again, by the end of January, actually, pretty much all of the long-term care residents and staff will have been vaccinated twice. So I don't know, again, I feel like we've made good progress, and it's actually happened fast.
Do you think we're going to see similar response in the non-medical fields?
I actually think we'll have fairly high response. I think the question is going to be, I think we can get to 60 or 70% pretty easily. To be successful, a number of our physicians have said we need to be 80 to 85%
Right.
Acceptance of the vaccine.
Right.
And so it's probably that question of how do you get the last 20?
Yeah.
So far we're really talking about just a handful of employers, and I think everybody has allowed it to be voluntary. It's certainly within the right of an employer to require it. And so, I think as we work through that process, we might see additional people. We've had staff who said, well, if it was required, I would do it, but until then I won't, okay. But I actually think we'll end up with a fairly high percentage. And truly, I do think this is a way to help kickstart the economic kind of redevelopment push again.
Yeah.
It's
Will
just
there be a uniformed message once we get more into the general populations about something that we can use, on platforms to push gently, encourage gently the need for that? Or do we just need to find some messaging?
Yeah, I think KDHE has some good stuff on their website, if not CDC, and we have PIOs that are helping us with this emergency response. We actually we had a new PIO start with us with the county PIO, Alice. She started with us this week, and so yeah, I imagine they'll be on top of that, and anything that you can help share, that would be great.
Okay, thank you.
So Linda, I know you need to get on another call. So do we want to talk real quick about K-State, any adjustments you guys are making for spring semester and kind of other things you might see that are changing?
Absolutely. And I'll extend my kudos to Julie and the team also. We work very closely with them on what we do here at the campus because it's like its own little community in itself. But a lot of excited people to see the text messages and the emails that went out on the emergency alert with the vaccination sign up. And we're working with Riley County Health Department on K-State's implementation of the vaccines. We are licensed with Lafine Health Center, and our population on campus for faculty and staff is about 4,500 people. So we're working with the county for when the vaccines would come to K-State. For the allocation that would come here, that we've got a plan that mirrors the phases that align with KDHE, which is what the Riley County Health Department's using. So we're getting a lot of requests because in that, if you see that survey, it does ask whether or not you're a K-State employee, a faculty, staff member, or student. So that information's in there, and there's that tie-in with information. And we will also be sending information out to employees, encouraging them. Technically, you cannot require it. I mean, they're looking at the legal side of that, if you can require vaccines or not. But right now, it's encouraged. We know a lot want it. There are some that are always questioning vaccines, so I don't know that we'll get 100%, but definitely there's a lot of interest, and it seems like it's a light at the end of the tunnel, but we know not to let the guard down, and that's the message we're getting across to campus. So we did, students will still be coming back. Classes start on January 25th, like we had originally planned. The semester will probably pretty much mirror what we did in the fall semester. The 2 weeks are going to be online versus the hybrid online and in-person classes. But students will be back in Manhattan. Those in the apartments, a lot of them you'll see apartments are filling up. Students are coming back. They'll still be in the residence halls. It's just for the first 2 weeks that all the classes will be online versus anything in the classroom. And that we were gauging it based on when the surge would hit following the New Year's Eve, the gatherings and parties that people had. So we'd hopefully get past that little surge before we brought, people into the classroom where they're, with faculty and with other students. So, and then we plan to carry out, we're still in what we call our phase 3, no events on campus larger than 50 people. Basketball is just, it's been scaled back no more than 15% in Bramlage. And if you watch it on TV or if you go there, it's less than 15% in there. And the key is keeping the basketball teams, both men and women's, off the quarantine list so that we have a team that we can play with or that we have opponents. So that's always questionable whether or not there will be a game or not. But there is no spring break. We announced that, back in the fall. We're giving 2 what we call mental health days that are worked in to help students with that extended time in the classroom, and are doing some things to help kind of relieve some of that emotional stress that goes along with all of this. And then we're gearing up our messaging also to remind people, even though the vaccines are here and they're being distributed, doesn't mean you let up on wearing the masks and socially distancing, hand sanitizing, and just being careful. And so that's we're looking towards what we might do for commencement back in May. Hopefully we promised a commencement for the last 2 semesters and had to cancel them both. But our goal is that we're going to hopefully have a commencement, and it'll be outdoors this year. So that's a plus to have it outdoors, but that's pretty much the kind of the new information that we have in this semester right now. So then it'll be like February 8th when we go back to the hybrid mode of teaching. Of part of the class would be in the actual classroom, and the other half would be watching that same class online.
Does anybody have any questions for Linda? Okay, well, thanks, Linda. Carla, could you maybe kind of update us on K-12?
Absolutely. So we started back to school on January 5th. Our teachers came in person on the 4th for...
At least I can't hear you, Carla.
Let me try this. Is that better? Can you guys hear me now?
Yes.
Okay. So we came back to school on the 5th of January. Our students did. Our teachers came back on January 4th. We're all 5 days in person at this point. We do still have our remote school really stayed about the same student numbers wise. So we still have about 900 students on the elementary level who are all distance learning. And then we've got another population at the middle school and high school level that are also remote, completely remote. But then our in-person students are right now in class 5 days a week, which has been, it's joyous for people. All of our students and teachers are really happy to see each other. We're hearing a lot of feedback in that direction, but it also brings with it its own set of challenges and complications and a whole new set of complications and learning opportunities for all of us. We are definitely still in need and always in need of substitutes and other additional staff. So we're still hiring. We are hiring in particular for a 7th grade science teacher. That's something that we have a need for right now. But then also, obviously, subs, bus drivers, nutrition department across the board. It is definitely a new challenge for us in quarantine. Not a new challenge, a different challenge. It has how it looks, how it works is changing somewhat in regards to the number of students in quarantine, the number of staffs in quarantine, and how long those quarantines can stack up. When we were in a hybrid model and you had students who had to be quarantined, we're doing so much through the online portion of it that although they were missing those in-person days, the instruction looked different, the model looked different. Well, now that we've got teachers teaching in person 5 days a week, no longer have that middle of the week planning time. So it is creating its own set of challenges for us to work through, and we're working through them to help those students who are in quarantine to be able to keep up with learning and continue learning from home. So I'm not going to say that everything is rosy, because I think we're definitely in a very you're walking a tightrope. We've been walking a tightrope all year. We got better at hybrid. We got stabilized with what we were doing, and we got better at what we were doing during the fall semester. And bringing back all of our students for a 5-day week brings with it its own new set of challenges. And as our numbers are where they are throughout the community, we're definitely watching things carefully and knowing that there might need to be some quick changes. So we're just working it through. It's still new in the 2nd week, and we're just going to keep working on it and improving what we're doing, but also watching what we're doing very carefully, because we want to make sure that we're keeping our students and staff safe.
Okay. Any questions or comments? I know Carla has to drop off fairly soon. All right. Well, thank you, Carla. I appreciate it. So when we met last month, or in December, we were anxiously, I guess maybe is the right word, but awaiting potential stimulus from the federal government. That did pass, and after a lot of debate. And I'm going to briefly go through the items that were included in that. And I want to give Dennis a ton of credit. We tracked a lot of the things that had to do with business, but Dennis sent me the summary of all the items that were in the bill. So I want to just go through it. And if we want to discuss any of these things specifically, we can certainly do that. So I think the thing that most people saw was the $600 individual checks for taxpayers, and then up to $2,400 for families of 4. I think a lot of people I've read have received, if not all, have received most people have received their checks, and I believe those are showing up in their bank accounts. And so it's good to see that money is getting out on the street. Obviously, there was a lot of debate about raising that, and ultimately they did not. So it is still roughly $600 for an individual. Unemployment benefits were extended by $300 per week, and that's for unemployed individuals. Then from the business side, there was another round of PPP that was included in this, and it's $284 billion. And there was also some tax clarifications on whether the funds received from PPP were taxable or not. And there was some clarification that those funds, if used for an allowable expense, weren't taxable. So obviously, from a business standpoint, there was some good news in this bill. And so I would encourage, we have people that can help, but there are bankers in the community that can help on this as well. So if you think you may qualify for PPP, talk to your banker or call us at the chamber, and we can help you see where you are in that process. There was quite a bit of money put into broadband, several billion, to increase people's access, and as well as a significant amount for transportation. So $2 billion for airports, $16 billion in payroll support for airline workers and contractors. And then there was also tax credits for companies offering paid sick leave. Obviously, there was a lot of money put into COVID direct related expense, including vaccine distribution and development. So 8 billion for activities to plan, prepare for, promote, distribute, administer, monitor, and track coronavirus vaccines to ensure broadband distribution access and vaccine coverage. And then 22 million shall remain available for the development of necessary countermeasures and vaccines. So a lot of money in there for medical and in distribution of vaccines, as well as testing related expenses. So another 22.4 billion through September 30th of 2022 for COVID testing. And then $1 billion for research and clinical trials related to long-term studies of COVID-19. The Act allocates $3 billion to reimburse eligible healthcare providers for healthcare related expenses or lost revenues that are attributable to coronavirus. $4 billion is provided for substance abuse and mental health services. Shall be available for, so not less than 50 million shall be available for suicide prevention programs, and 10 million shall be for the National Child Traumatic Stress Network. 10 billion and as a supplement to state revenue funds for child care assistance for low-income families. And then the Act extends a temporary eviction moratorium through January 31st, 2021 on the evictions and rental assistance, and provides 25 billion in tax-free rental assistance. So that was a summary Dennis provided of the Act. I know there was a lot of other media talking points as related, I think because it passed the same time as the omnibus bill did. All the foreign aid, those kind of things, that was part of the annual omnibus bill. Those were the items directly related to the Coronavirus Relief Act. Any comments, questions, things we might have missed on that? I know there was some discussion about aid to counties and cities. Ron, I don't believe that was included in this one.
It was not directly. There's still some possibilities. I think probably the other aspects, at least some of the information we just got yesterday, was that the PPP loan program is now eligible. The eligibility has been extended to nonprofits and local newspapers. Also, there's dedicated funding for live venues, independent movie theaters, and cultural institutions. None of those were eligible previously. And then there's also 20 billion targeted towards economic injury disaster loans and grants designed for Main Street small businesses. So those are some of the newer programs that we don't have a lot of information about yet. Or, we don't know whether these are coming, directly to the feds, like the Chamber of Business Assistance component was, or the small business component was with PPP, or whether it's going to be funneled through the state. So there's a lot there, and probably another round to come.
And then the other item that was in the topic for discussion that was not included, in addition to states cities and counties, there was some discussion about helping businesses in terms of liability, and that was not included. Liability protection for small business, that was not included in this bill. So just as a summary of some other programs that we've discussed earlier, early on in this process, we had worked with the city on a loan program, and we did about $350,000 in loans up to $5,000 to around 100 businesses in the community. Those were loans at zero interest. We are starting to see some of those get paid back, and we will return those funds to the city. We were able to work with the county to get around 2.6 million into the hands of small locally owned businesses in Riley County. And I know Pottawatomie County had a similar program. I don't have the numbers on that, but I know at least 7 or 8 businesses in Manhattan that receive funds from Pottawatomie County. And then, of course, the state had a direct aid program to small business, and 68 businesses in Raleigh County received assistance, and 25 in Pottawatomie County received assistance. And those were up to $20,000 in most cases, grants, and those are available online on the Spark website if you're interested in seeing that. So again, that's kind of a summary of financial assistance that for businesses as well as for individuals. We will continue, as Ron said, to monitor the rules and the things that come out of the last CARES package. I would encourage you again, it sounds like PPP is going to go through banks again, contact your banker. And a lot of the EIDL is an SBA program, that's a disaster fund. And so that's a SBA application. Again, give us a call. Darren Solden in our office can help you through that process. I'm sure the Wamego Chamber has people that can help through that as well, although I know Darren's been helping them through some of those issues. And if you're in Junction City, call the Junction City Chamber, and I'm sure they can direct you to some resources to help you there. Any other comments or questions before we move on to the survey? Okay, so continuing on with business update, we've talked at length about the creation of a survey to better understand what businesses are experiencing and try and get a gauge of what they think about the future. The Flint Hills Regional Council has put together a business confidence survey for our businesses, which is currently live, and the task force was sent a link last Friday. To give us an update on the survey, we'll turn it over to Christy and Marissa, who will go through an update on that. So, Christy.
Yeah, great. So I'm excited. Marissa has worked really hard. She did a lot of outreach to our 7-county area. And so we got a lot of input that then fed little tweaks here and there to what went into that survey. And so, yes, it went live last Friday. And so anyone on this call or listening in to today's meeting, if you are a business or know or have a network that you could send that out, please be our cheerleaders out there to push the survey to as many businesses as you can. The chambers in each of the communities, economic development corporations, business associations throughout the 7-county area are participating. That 7-county area is our Flint Hills Economic Development District. And so we will be putting together a recovery and resiliency plan for the entire 7-county area. And obviously Manhattan, Riley County, Potawatomi, Geary County are a really critical component of that. So with that, so there's more to come. We're also going to be putting together a needs assessment system. So when the additional funding starts flowing through, then we know what those needs are and can try to assist with that. With that, I'm going to hand it over to Marissa, and she can give a kind of a snapshot of where we're at right now with the survey.
Christine, I want to thank everyone on the call that I've talked with or that's taken the survey or helped distribute the survey. That's been huge. Right now, we have received about 59 responses, with the bulk of those being from Manhattan. The next highest respondent was Wamego, then Westmoreland, Junction City. Then we've received some responses from our other communities in our region. We've also received responses from 2 outlying counties. Presumably they were parts of other chambers. Either way, that data is still very useful, and we'll be making sure that those businesses are also addressed. I'm a little hesitant to share any preliminary information just because with only 59 responses out of a 7-county area, that's not necessarily going to be representative of what our businesses are actually all as a whole thinking. But some of the short-term items, a lot of them, a bulk of our respondents actually expressed interest in marketing and social media marketing training. And so we've been working with our small business partners to see what type of training are available. So on our social media outlets, we're going to start pushing out training resources pretty hard. And I know all of the local chambers do that as well too. But we also want to make sure that we're hitting those businesses that might not be chamber members, because they're obviously going to be ones that need those types of training as well. An interesting kind of statistic is that the bulk of people that responded, and this question was actually skipped quite a bit because a lot of people aren't too keen on providing information about the specifics of their business, but about 57% of our respondents are women-owned businesses. And there are some funding sources that just came out for that, so we're going to start pushing that out pretty quickly as well. So as we keep getting responses, I'm hoping to close the survey February 5th. that'll be 4 full weeks of having the survey open and available for responses. At that point, I'll summarize data and hopefully have it ready to present at the February 11th meeting. At that point, we're hoping to have enough responses that it actually will be indicative of the region. And fortunately, no businesses have reported that they're concerned about closing within the next 1 to 2 months. So even though we have a little bit of time to work with, we're going to keep pushing out resources as we see fit with some of the responses that we're getting in. If any of you have any questions, please let me know. If you know of any businesses that might fall outside of Manhattan or outside of the county that you work in, if you have any friends or contacts in any of our other counties throughout the region, please feel free to send this to them, and we'd be happy to get their responses and see what kind of assistance we can provide for them as well.
So also real quick, Dennis sent out the link to the Manhattan Area Recovery Task Force. So you do have it in your email, but for those that are watching, it is also up on our website's main page, which is www.flinthillsregion.org. And then I mentioned 7 counties as if everyone knows what 7 counties. So let me just say that real quick. So it's all the counties, Riley, Potawatomi, Geary, Wabunsee, Morris, Chase, and Lyon County. Those are the 7. So if you have any questions, feel free to let myself or Marissa know. Marissa is the lead on this and has done a great job. So thank you, Marissa.
Were there any questions for Marissa or Christy? We're a very quiet group today. Okay. Well, so one of the things we've tried to do each time is just kind of do a little bit of a circle back and just see, are there other things that have come up over the last month that we can either talk about today or we need to do a little work on or research for our meeting in February? So just want to open up for some discussion within the task force.
I actually have one, Bob. I know this kind of extends from our Monday afternoon call as well. As we need to get some kind of a messaging out on what the vaccination process actually is. There's a lot of people who think that you can take that first shot and life goes on and off comes the mask and off comes social distancing. And then the second one is there and all's well. But the reality is, you know, there's a 2-3 week gap in between both of them. There's a 2-week period before the vaccination is full after that second shot. And I don't think a lot of people are understanding that we still have to have some patience involved in this scenario until we get to the other side. And I'm concerned about what that may mean in the middle of all that as we're still trying to work through it. So somehow we need to get that information and that educational piece out so that people are fully aware of what all this entails and means.
And I think another key point, John, we believe you can still transmit the virus after being vaccinated. So that's why we've got to get to that 80-85% vaccination rate to actually keep people healthy in the community. That's a good idea. Other things, sure.
I was just going to agree with John. That was another point I was going to mention. And also, as other vaccines come out, I think there may be one coming that is just 1 dose. So that may cause additional confusion. So making sure, as you mentioned, just that education piece and how we get that message out, whether it's through our local agencies, our service agencies and employers, and just what that might look like if we are trying to communicate to the general population.
So Jason, we're going to have you show pictures of your trip.
No, you don't want to see those.
So like I said, I believe that is actually pretty much our agenda today. So, so one thing we talked about, I think in December, we're shifting to having our meetings once a month. So our next meeting will be Thursday, February 11th, same time. And again, if something is coming up that everybody thinks is need to pull people in, we will certainly talk about that. Oh, hey, I'm thinking about Shiloh. Did you want to talk about property taxes?
Oh, yeah.
I'm starting to remember things randomly now.
No, you're good. I kind of forgot that I have it here. So I gave my report to the commissioners this morning. Property tax collections came in very similar to what it was last year. Our outstanding collections in 2019 was 45.42%, and our outstanding collections through December 31st of 20 was 47.03%. So it's a difference of 1.6%. So not significant. Our motor vehicle registrations and renewals and titling, we were down about 200 transactions compared to last year. We are still seeing quite a few people that have not renewed. Either they're renewing late. So I was pleased at least with that number. One thing that we did see, we saw a pretty significant increase in our online services. So we saw a 22.5% increase in the number of people that renewed their tags online. And we saw about a 55% increase for people who paid their property tax using our online resources. So I was really pleased with that. It's just so that meant that was that many people not coming in the office during that critical period. Sales tax, we ended up in the county at about 1.2% year to date, less than we were last year. But even that being said, we did make the county's budget of what we had budgeted for sales tax. So obviously the areas that were hit the hardest were what you would expect: entertainment and lodging and accommodations. But I was still pleased with those numbers. So yeah, I'd be happy to answer any questions that anybody might have about any of those.
Do you have one for you, Shiloh? I know we've, me and you have talked about this several times, but do you think that there would have been an even larger increase of online services if applicable and extra fees weren't attached to some of those along the way?
Oh, of course. I'm sure we would have a lot more people using those online services if there were no fees associated. But as we've discussed, that would be a county decision that if they would want to take on that expense. So the e-check option is only $2. So you'd spend that much driving down here and waiting in line to make your payment. So but yeah, thank you for allowing me to have a few minutes.
Perfect. Thank you, Shiloh. Hey, Robin, did you just want to, I know you guys have been having a little chat box conversation. Do you maybe just want to talk about what we're seeing from a behavioral health situation?
Absolutely. Yes, during the thick of things in 2020, we saw the request for services drop. I think that, and so even though we moved everything to telehealth, including how people would access services, what we saw was that people were not reaching out for care like they had been prior to when the pandemic started. The exception was in crisis services. And thank goodness that we opened the Crisis Stabilization Unit in November of 2019, because I'm really not sure what would have happened in this community if we didn't have that resource during this last year. The utilization of the Crisis Stabilization Unit has remained consistent throughout the pandemic. And in fact, the numbers of people who've been reaching out for crisis assessment has increased, where those requests for more routine services really was more diminished. What we are seeing, we're very grateful for the fact that we're able to continue to provide services through telehealth, because we are seeing increased numbers of people being impacted by the virus. And rather than just choosing telehealth as a preventative measure, they're needing telehealth as a way, because they're either quarantining or in isolation. So our experience certainly is underscoring not only the desirability, but the necessity of telehealth as a treatment modality for providing mental health services to our clients.
Thanks. Last thing I was just going to ask Dennis Cook or Gina Scroggs, I'm already looking ahead to warmer weather. So any thoughts about what we might be seeing that might be a change or an enhancement for outside, either dining or other activities in your business districts?
Well, I can, beginning for us is, yeah, we're hoping for anything and everything to happen. I do know that, Kansas City, Missouri just opened up and extended the hours for drinking establishments as of yesterday. And we're kind of hoping that as warmer weather and patios get more active, that we can help these businesses do more business down here. So, the 12th Street redevelopment is about done. And so what you're going to see over there by Tanner's and Taco Lucha and so long, we should see some more outdoor dining, and that will be a beginning of some of the new stuff for us. Downtown's got a whole lot more of that.
You ready?
Yeah, go ahead, Gina.
We are really looking forward to sort of returning to some normalcy. We have a lot of outdoor events that we normally do. We have some events that are easily modified to become outdoor events. And we hope to be able to really just move right back into those. We're looking forward to getting back to our Pink Up the Pace 5K and 1 mile honor walk, which is a breast cancer research run that we do every April. And that will lead us the following month into our third Thursdays arts and entertainment series that we do May through September, which is also outside. We hope to be able to return to that with artists and entertainers and all kinds of really neat art and live interactive things going on the street. Should be a safe environment, no different than if you were walking around in a parade area or at a run. I think we can keep it safe and do it right. And then we have a really big event every year called Taste of Downtown. And that's a sellout event of 400 tickets. And we hope to be able to move that out into the street instead of having the ticket holder come into the restaurant. We hope to just sort of utilize the platforms and move people along. Want to do, hoping to do a special event with alcohol for that and close off the streets and kind of let everybody mill around a little bit for that 3-hour long event. So really just, and of course, bring back the carriage rides at Christmas time. We hope we can do all of this safely. We think we can do it all safely. We're really looking forward to the return of the 7 to 8 month long outdoor dining season. Really working on trying to get everybody to be able to serve outside. So I feel good about it. I think we could do so many of these things safely, and we're going to try. We're going to give it our best shot.
Thanks, Dennis, and thanks, Gina.
Yeah.
Anything else before we wrap up?
I could probably give you a little quick update of the clean air campaign that's going on up at Middle Ark Hills. That's a $250,000 effort that it's almost reached. We still about $20,000 that we're waiting on the challenge grant, and that'll put the same devices that are at the K-State dormitories up at Middle Ark throughout the Middle Ark campus to help those residents just one step more in that whole process. There also is a discussion that's probably going to be taking place about supporting the workers in our senior care facilities, and there'll be more news about that coming down the road.
Very good. Well, we will see everybody on February 11th, 2 o'clock. That works. Thank you, guys. Thanks, Jared, for covering for Dennis today.
Yeah, you bet. Thanks, everyone.
Bye.
Everyone.
Take care. Stay safe.
Thanks, everyone. Stay safe.